Good evening, everyone. You're welcome to my channel. If you are just tuning in for the first time, please do well to subscribe. And for my returning subscribers, thank you for tuning in this evening. In my previous video, we talked about prevention of diabetes. The risk factors were listed and ways of overcoming it was also talked about. So today, we are talking about how to diagnose diabetes and simple daily tips to improve quality of life. This is like the part 2 of our previous topic. You can stop diabetes. Looking at this chart by CDC, there is Centers for Disease Control and Prevention. This is the road to type 2 diabetes. We know that type 2 diabetes is a lifestyle disease. So how can you know? How can you diagnose diabetes? Starting from below, after meeting with your doctor, either after having signs of diabetes, your doctor can tell you to run some of these tests. The first test is the A1C test. The A1C test is also known as the hemoglobin A1C or HbA1c test. So it is a simple blood test that measures your average blood sugar levels over the past 2 to 3 months. So it's one of the commonly used tests to diagnose pre-diabetes and diabetes. So after being checked using the A1C test and the result falls below 5.7%, it means that the person does not have diabetes. That person is normal. But if the result falls between 5.7 to 6.4%, that person is pre-diabetic, meaning the person is at the borderline of having diabetes. Then if the result shows 6.5% or above, that individual is diabetic. The next test that can be done is the fasting blood sugar test. Fasting blood sugar test is done in the morning, especially after waking up and you've not eaten. That's why it's called fasting blood sugar. The previous night you ate and you slept. Waking up the following morning, you do the tests without eating that morning. That is the fasting blood sugar test. If the result is 99 milligram per dl or below, it's a normal case. That person is normal. If the result falls between 100 to 125 milligram per dl, that individual is pre-diabetic. But if the result is 126 milligram per dl or above, that individual is diabetic. Then the last test on the chart is the glucose tolerance test. Glucose tolerance test is done after taking a liquid containing glucose. When you wake up in the morning after doing the fasting blood sugar test, you take the liquid containing glucose. Then within 2 hours after you've taken the glucose, you are tested again. And if the result comes out to be 140 milligram per dl or below, the individual is normal. If the result falls between 140 to 199 milligram per dl, that individual is pre-diabetic. If the result is 200 milligram per dl or above, that individual is diabetic. Another test that is done is the random blood sugar test. That one can be done at any time, even after eating. But if it is 200 milligram per dl or above, the individual is diabetic. So make use of the glucometer in testing the blood sugar. Some individuals can have it at home. They can be taught how to use it, especially those who are already diabetic. They can be taught how to use it so that from time to time they can check themselves to know the numbers, the values of their blood sugar level. If an individual does not feel well or thinks he or she has diabetes, especially type 1 diabetes, it's better to go to the hospital where you can be tested. So the type 1 diabetes can be detected by testing for autoantibodies. These autoantibodies as substances in the body that attack itself, making it impossible for the pancreas to release insulin in order to regulate the blood sugar. Gestational diabetes is common in pregnant women and is tested for between the 24th to 28th weeks of pregnancy. But to be on the safe side, it is better to test early in order to know if the woman has type 1 or type 2 diabetes, so that it will not be mistaken for gestational diabetes. Type 2 diabetes is a lifestyle disease. The symptoms of type 2 diabetes include urinating more than usual, especially at night, excess fatigue, always feeling tired, feeling thirsty all the time, unintentional weight loss, wounds taking longer to heal, itching around the private area, and this is one of the complications of diabetes. So meaning it can lead to candida infection. Then lastly, blood vision. So how can diabetes be managed? One is by eating variety of foods. Being diabetic does not mean that you should not eat. But even as you are eating these different types of food, you need to eat in smaller portions. Eat variety of food which include fruits, vegetables, probiotics. Example of probiotics are yogurts. Yogurts that have probiotics that help to fight infection. They provide healthy bacteria, healthy flora in the body that helps to fight infection. So if you are someone who eats refined products, you just need to eat healthy. Eat more of whole wheat products, food made with whole wheats. There's whole wheat bread, there's whole wheat pasta, and also reduce your consumption of polished rice. It's better to go for the rice that is less refined so that you can get the nutrient needed for your body. Try to lose weight by reducing the amount of food consumed. Eat small portions, so reduce the amount of food you eat and keep a healthy weight. Minimize sugar, fat, and salt intake because all this contributes to the building up of the blood sugar in the body. So minimize these things. Even Maggi that is added as a flavor to the food should also be reduced because it contains much salt in it. Do not skip meals, especially breakfasts. Always go for regular medical checkup so that you can know how far you're doing in respect to your health. So eat good food. Don't miss breakfasts. Then be physically active. Engage in activities like brisk walking. That is the best form of exercise. Climbing stairs and gardening. At least 3 hours of conscious and purposeful activity per week. Take out about 30 minutes to actively exercise with the aim of reducing your weight, with the aim of being healthy. It should be a conscious activity. Seek assistance or get a support system to help you achieve healthy living. When you find out that you cannot help yourself, you see yourself falling back to those unhealthy practices that caused the diabetes, it's better to speak with your doctor to help you achieve your healthy lifestyle. If you are given a medication, being a diabetic patient, please do well to religiously take these medicines. Even when you feel well, take the medication as prescribed by your doctor. Stay hydrated and get adequate sleep. Sleep is important. Tips for day-to-day living. Always wear slippers or shoe to prevent sharp objects from piercing your feet. One of the things we listed about the symptoms of diabetes is that the wounds or cuts they have takes longer to heal. So to avoid such wounds, always wear your slippers or shoe to prevent sharp objects from piercing your feet. Make use of nail cutter instead of razor blades when trimming your nails to avoid cuts. Do not use water that is too hot to bathe. To know if the water is okay for your skin, gently dip your elbow into the water to check if your body can tolerate it. But if not, you need to add cold water in order to bring it to the state that your body can tolerate. Set the alarm to take your medicines and take it even when you feel good. So do exercise, eat good food, stay hydrated. The time spent in front of the television or your phone should be reduced because it can distort your sleep. In order to sleep well, ensure that you sleep in a dark room, and also you don't spend time in front of your screen before going to bed. It will help to enhance your sleep. And always speak with your doctor. Your doctor is your friend. In conclusion, since diabetes, especially type 2 diabetes, is as a result of an unhealthy lifestyle, make a change in your lifestyle today to stay healthy and stop diabetes and avoid other health problems. Thanks for watching. Subscribe if you have not done so, and be happy. Live healthy, live hopeful. See you next time, same station. Bye.